Hey, South Plains, Amanda McAfee with Lubbock Area United Way. I am joined today by Nedra Hotchkins. She is the Executive Director for Lubbock Children's Health Clinic, one of our community partners. And they have really done some amazing things to shift their work and continue being a medical home for the families that are in their area and answer some hard questions, I think, at times for not just their clients, but also their staff as well. And really been doing some amazing work in the last couple of weeks. And we wanted to share with you what they've been up to. So Nedra, how you doing?
I'm doing wonderful, Amanda. I'm doing good. I'm doing good. Thank you for asking.
Well, we're so glad to have you here and so glad that we finally got a chance to sit down. I know most of our healthcare professionals have been pretty busy in the last couple of weeks, but things have slowed down a little bit and we're able to have this conversation. So Nedra, why don't you just start with, tell us a little bit about the health clinic, the two clinics you have, and how you guys shifted your services to be able to keep helping folks during the crisis.
Oh, wonderful. Well, I'm happy to answer that. Well, with Lubbock Children's Health Clinic, as you know, that we service children ages birth to age 18 years of age, and we continue to provide preventive services for children. One of the things that we do in both of our clinics. And so, with the services that we're providing, is still the acute visits, the sick visits. So, even during this COVID era, unfortunately, we still see sick kids, right? And so, we're still providing those services for children. One of the things that we have done here recently was shift. The services in which clinic they're provided at. So, for example, we have two clinics. One is in East Lubbock and one is in North Lubbock. In our North Lubbock location, we are providing services for just children who need their vaccinations and well visits. This is a time that, if ever, that families still need to make sure children are healthy, that they are still coming in to get their physicals and their wellness exams. And so we're doing all of that at our North Clinic. And then at our East Clinic, we are seeing just sick kids. So if your kid is just sick, not COVID sick, but just sick, that we have spread out our clinics to be able to accommodate those families and families who are having some concerns as well too. So we're able to do that. Our staff is we still are fully staffed. We're still open during our same business hours. And I will say, at either clinic that you come into, that if you do feel like your child is still in need of the medications and pharmacy vouchers, we're still giving those out. We've actually, during this COVID era, because we know that some parents had a really hard time getting a hold of some just the over-the-counter medications and thermometers and things like that, we've been able to provide that to families. So when they come in and they're just in need of some of those things, we have put together some medication bags to be able to give to families during this time at no cost to them as well too.
Those over-the-counter medicines can get kind of pricey, can't they?
Oh, yes, absolutely. And so families have been really, really gracious during this time. As a mother of two, I recognize that that kids, again, they get sick, and during this COVID area, it's kind of hard to get them. And so it's about a bag about $50 worth of medication for kiddos and thermometers and things like that they need. So we just want to make sure that the community, knows that we're still here, that we're still taking care of the kiddos, that there's still a place where they can go to get their medical needs met. So for us, we're still very much in there. We're still taking walk-ins where children can come in. They don't always have to have an appointment. We are doing screening at both clinics, so that has not changed in regards to making sure that their temperature checks and making sure that if they have cough. And if families do feel like their kids are still have those symptoms of COVID, we're walking out to the car, we're still taking those tests and making sure we weed them out. So we want families to know it's still a very great opportunity to bring your kids in. We're taking all the safety precautions that we can for not only the children and the families, but also for our staff.
Well, I think that's great, Nedra, because there are a lot of medical things that are happening right now that are just the
Yes.
normal medical things that are
Mhm.
just the normal, whether it's a well visit or, we're just coming out of flu season or going into allergy season. I mean, there are still other things that are happening with families, and it's great that you guys are still there and able to support families in that way.
Yes.
When we think about Lubbock Children's Health Clinic, you and I have talked a lot about y'all are, in particular, your mission is to serve medically underserved areas. So when we say that, we mean places that don't have as high access to clinics, to doctors' offices, to hospitals, to uh, any of the things that some of us might take for granted. And really, not only do you want to serve those folks, but you want to become a medical home, that you want to be a place where, just like with my kids and my pediatrician, it's the first person we call. We don't just automatically go to a walk-in clinic. We go to you guys first, and y'all have worked really hard to become that in the neighborhoods that y'all are working in. So when we think about, though, that population that's a medically underserved population, what are some of the concerns and fears? I mean, I imagine they're similar to some of the concerns and fears we all have, but what are some of the things that you guys are hearing and dealing with and answering questions about right now?
Absolutely. Thank you. We are, our mission and how we're placed is around serving underserved communities. And I think that is what we're good at. That's what we do. Some of the concerns that we've been seeing a lot lately in our community is around medication, right? About families having access to medication, still the fear of kind of coming in. One of the things that I've recently learned, even around transportation, families are, even if you have sick kids, they're worried about how do I get there if they're used to taking public transportation. That's become a big issue as well too. Families are also concerned with the loss of jobs. How are they paying for it? And as you know, Amanda, at Lubbock Children's Health Clinic, we make sure everyone who comes to the doors gets seen. So we don't turn anyone away, regardless of their ability to pay. And I think that's what we want to continue to make sure that our community know. But also we serve medically underserved communities. That's what our mission is, and that's what we do. But we also serve families. I always, the opportunity just to serve. A lot of families right now can't get into their own pediatrician. And so we're happy to always see children in general. We serve our Lubbock community as well. It's also making sure that families during this time understand the difference of when do you take your kid to the emergency room and when do you just take them in to see the doctor. And so for us, for those families who don't always understand the differences, or if they're scared parents who their kids been crying all night and have a high temperature, they don't know what to do. And so oftentimes they'll take them into the emergency room, right? And so what we try to do is make sure that families know that we're here. You could bring them first thing in the morning without incurring that additional cost and having a bill on your hand that you may or may not afford. And so the issues are similar to what families we've been seeing in our community have been having, but also times you get families in there and you realize, okay, again, during this COVID issue, is that they're coming for medical, but they've lost a job. They don't know where to get food. Again, I did not realize, even with the formula, how hard it is for some families to come by formula. So we've been able to partner with some other community agencies to make sure we can get vouchers in for children who need formula, diapers, those type of things. So one of the things I have learned, and I continue to learn, is that the needs are ever growing, right? And so sometimes what we've had to learn is that we're in a situation where when families come in for medical service, they may need something more than just that. And our staff and our team is equipped to be able to connect them with other resources, other agencies during this time to get them exactly what they need during this difficult time.
That's so fantastic, Nedra. I mean, I think when you go into the doctor, there's oftentimes some of those things come out that maybe you haven't told anybody yet, that you don't know where to get diapers or formula. Two of, by the way, the most expensive things on the planet, right?
Yeah.
And some of those things come out because that's a healthcare professional is somebody you trust, right? Because they're sitting there, they're taking care of your kid, they're taking care of your kid well. And so some of those things come out, and it's so good that you guys are able to connect them with others and not just stop at meeting the medical need, but continue on and make sure, because of course all of those things are connected. If families aren't getting enough food, then that's going to escalate the health issues in their family and those sorts of things. So that's fantastic that y'all are able to connect and make those connections. So Nedra, I want to hit on a point that you talked about there. When we think about families that are going to the ER and their kid has 104 temperature and they don't know what to do and it's the middle of the night, families don't go to the ER just because that's their only choice, or just because it's more that they haven't had the education. They haven't been brought up knowing this is when you go to the doctor and this is when you go to a clinic, or here's a hotline that you can call to ask a nurse if you should go into an ER, a 24-hour clinic, or those sorts of things. So there's more of an education thing happening here, and making sure that people have access to good information. Can you tell folks a little bit more about that? Because I'm not sure we always grasp that.
Right. Well, first, I think a lot of families, underserved community families, or just some families who just don't know, they go into the ER because what we've learned is if they don't have insurance, right? And so it is the place where people go because they feel like something's wrong with my kid. I don't know what to do. I'm going to go to the ER because they have to see me and they have to provide my children with some medication, right? And so what becomes a non-emergency, an emergency for children. And so at the end of the day, you want to make sure, like for Lubbock Children's Health Clinic, we encourage parents, yes, if your kid is running a temperature, right? If they're vomiting and it's uncontrollable, when do you go to the emergency care? For us, for a lot of times, we want to make sure that families know that we are a resource to that. And so again, that there's various symptoms, if a kid jumps off the bed and of course their arm, they've damaged their arm, it looks like their bone, you want to go to the ER, right? Because we can't help you there. But if it's just like they're coughing overnight, is that something that I can possibly wait and take them into Lubbock Children's Health Clinic in the morning, or an urgent care? Those are the type of things that you want to look for. And I think for a lot of families, it becomes a matter of just being able to get health care. And so if it's just about being able to get health care, we want families to know that there is a place for them to get health care for their children in a reasonable amount of time, providing excellent care, being able to provide their children with medication or pharmacy vouchers that they need without the added expense. And so for oftentimes, I think that it is just one of those things that when we talk about education, they'll just go. Right. And I think it's out of need or what they feel like is a necessity because not being able to pay. And so with a lot of families, we just want to make sure, again, if it's life threatening, that's when we want you to go to the emergency room. I'm a mother, and there's been calls where I'm like, my child needs to go to the emergency room because they have that high fever and I don't know what to do. And I've been putting towels on their head all night. Right. But no, that's probably not, unless it's been a continued thing, and then you have to check in or call. But we want to really educate families to know that choose a medical home, right? And so for a lot of families, you may have that, again, we talked about having that pediatrician, that person that you call. We want individuals to know that you can call, Lubbock Children's Health Clinic, say, is this something I need to bring my child into the clinic for? Or these are the symptoms that my child's been having. 9 times out of 10, most of the times when we've had families come in or we've got reports that they went into the emergency room, it really was something that they could have just been seen for in the clinic, but it scared a parent. And usually it's always around the high fevers or the vomiting, diarrhea type of thing. And sometimes it could be a stomach bug, if it's asthma, we also treat asthma at the clinic. That can kind of be tricky, right? And so sometimes it's a matter of getting the kid to an urgent care in a timely manner. Sometimes it's a matter about just, getting them into the clinic for a breathing treatment. And so, at the time, parents just need to know the difference. And so we want them to be able to understand that. But I think, Amanda, too, part of our mission is to make sure that children are providing health care, and for families to know that you don't have to treat the emergency room or the urgent care as if it's the doctor's office, right? Is that there is a place where you can bring your kids, and you could be a private pay, you could be, underserved, you can have Medicaid, or you don't have to have any insurance at all, but there's a place you can bring your kid, and it doesn't have to be the emergency room. And I guarantee you, we're going to get you out faster than the emergency room or the urgent care, and we're going to follow back up with you. And in the event that it's something that we find that we have to send you to a specialist, we're going to make sure that's being done as well.
No doubt. Y'all's lines are a lot shorter than that at the ER, and you're going to get seen faster and be provided with excellent quality care at the same time. Nedra, moving forward, we're opening things back up slowly but surely, and hopefully getting back to what the world will look like after this, whatever that means. But what do you guys need moving forward? What have been some of the challenges you guys have faced, and how can folks help?
Well, Amanda, one of the things that we were in need of and continue to be in need of is the PPE equipment. Again, we continue to want to make sure that families are being served. And when we have to serve families, we recognize that dealing with families who may have to have they don't always have multiple means of transportation, right? Or a means of transportation. And being able to have certain things in the clinic was really important for us, being able to partner. And so understanding that the scope of the services that we provide was going to change a little bit, right? And so for us as a clinic, again, the PPE equipment was one of the big things that we needed, but also being able to continue to partner with other agencies to make sure that families had what they had. And I say that because I had, when listening to one of our families, she had talked about how she needed the diapers and she needed the formula, but she also needed to go to grocery store. And of course, there were some things that we could be able to have, but then she also had walked to the clinic. And then how was she going to carry all of these things, right? And so for us, it's a continuity of making sure that we're meeting the needs of the community beyond just healthcare is our primary, but what other things can we do? We've been really fortunate, I think, as a clinic, to make sure that there are so many other things that other community agencies were able to help us with in the very beginning. We continue to, like I said, with the PPE equipment, but outside of that, we've been really fortunate. Lubbock Children's Health Clinic is a nonprofit, clinic. And so we're always, like everyone else, there's always that funding issue, but I think that we're really in a good space right now as it relates to other community agencies just kind of partnering with us to make sure that we're able to service the individuals who's in our community.
All right, Nedra, I just want to thank you so much for your time today. I want to say a special thank you to your staff, your whole team. I know that it is hard to be in the healthcare profession right now. It is very difficult, whether y'all are seeing patients with COVID-19 or not, or whether you're seeing patients, which I know you have seen patients that potentially might have. Yes. And it's scary to be in the healthcare profession right now. It's probably scary for a lot of your team to get up and go to work. And I'm sure y'all have dealt with a lot of anxiety and mental health. I was so happy when I saw y'all's TikTok the other day. That was great and a good mental health break. And so I'm glad you guys are taking care of your mental health. And just thank you to your team. Thank you for you and what y'all are doing. We're so appreciative of you guys.
Well, thank you, Amanda. We appreciate being part of a United Way family that looks after each other. And so we've been very fortunate during this time. And so we're continuing to be here for our community and for those who need us most. So thank you all so very much.
All right. Thanks, Nedra. And thank you, South Plains. We appreciate your time again today and hearing from us. Like I said on the last one, we're going to continue to do this. We're going to continue to connect with our community partners. We've got several more that we haven't connected with yet, and we want to hear what they've been up to and how they've been addressing the crisis, and also start talking about how they're shifting their services now that things are opening back up. So thanks so much for your time, and y'all have a great day.